We have a question from Bonnie Chesford. Please go ahead.
Oh, hello.
Hi, Bonnie.
Hi. I've finished my chemo, the carboplatin and the Taxol 16 months ago, and I'm doing well as far as no reoccurrences, and I'm feeling well except ever since the chemo and during the chemo, I have had terrible gas and acid reflux. Is that a side effect of the chemo, or is that something I would have had anyhow? And is it going to continue?
Well, that's a good question. During the chemotherapy treatment, one of the anti-nausea medications we use is called dexamethasone. You probably received that. Yeah. It is known for causing a condition called gastritis, and it can lead to acid reflux.
Okay.
During the time of the chemo, usually we treat that with just simple antacid medications like Zantac or Losec.
Okay, I have Pantaloc.
Or Pantaloc is a good one as well, yeah.
Okay.
However, after the chemo's finished and you're no longer on those steroids, the dexamethasone, we do expect that acid reflux to slowly improve. So I think if you still have persistent acid reflux, you may just want to talk to your family doctor and make sure that there's no other non-cancer related problems. So common things that can cause the sensation of heartburn or reflux is infection with something called H. pylori, which is a bacteria that can cause irritation of the stomach and increase gas production and discomfort. So that's one thing to check. And your family doctor would know how to approach. It's a very common complaint. They should know how to approach it.
Okay, because this has really been causing me a lot of trouble. And I have also insomnia, and it doesn't help when you go to bed at night and you can't sleep because you're burping and having a sore stomach all the time. Yeah.
And you actually get the burning. You get the burning in the back of your sternum, behind your chest bone.
Yeah, it's the gas is worse than the burning actually.
Okay.
So, but that would still be something.
Sorry.
It would still be something that I should get checked further with my family doctor.
Well, I think so, because often there are other things going on, and we tend to chalk it down to chemotherapy or cancer or surgery, but it's nice to know that there's not just something else completely unrelated to cancer that might be
causing this,
contributing to, yeah.
Okay.
'Cause usually with the steroids, within a few weeks or a couple of months after stopping them, those symptoms should really improve.
Okay. Well, 16 months is a little too long, I guess.
That's a bit long.
Okay. Well, thank you very much.
Yeah, good luck with that.
Thanks.
Your next question comes from Jane Baker. Please go ahead.
Hello, my question.
Hello, Jane.
Hi. Can you hear me?
Yes, I can, definitely.
Okay.
Go ahead.
My question has to do with integrated cancer care, and I'm wondering how much research is being done in Canada, and if so, where, that would integrate the effects of different types of diet, exercise, homeopathic remedies and so on in order to reduce necessary doses or extend disease-free interval.
Well, that's a good question. I'm not aware that any one cancer across Canada is doing a lot of that kind of research. There are usually in most cities, and I know in Vancouver we have it, what would be considered sort of an integrated cancer care center. So a center with doctors who provide vitamins, lifestyle advice, other complementary therapies, but we're not intimately involved in research with them. One of the barriers, I believe, to this kind of research is funding. Costs a lot of money to do research, a lot of money to study patients, and someone has to fund it. And so if there's, and as you know, probably there's a lot of funding right now for trials that comes from pharmaceutical companies.
Right.
But a lot of these homeopathic type of approaches or alternative health practitioner approaches don't come with a lot of, financial sort of oomph.
Right.
And so it becomes very hard to find any source of funding for them, and governments generally give us very little funding for research. What they give us would never progress the treatment of cancer patients. It's too little to fund anything meaningful.
So that would have to come from a government source or from a university.
Yeah, and their funding sources are usually very limited.
Right. It's frustrating as a patient. I'm a recurrent ovarian patient, and I am on a PARP1 inhibitor clinical trial.
Okay, good. Yeah. Yeah.
But it's very frustrating for us knowing darn well that there are positive effects created in lots of instances. Like there is evidence, although it may not be drug company double-blind trial type of evidence, that nutrition and diet and exercise and all of that sort of thing will make a difference to our, to the positive outcome.
Yes.
But without being able to have our own oncologist comment on it, except to say, there's no evidence.
Well, that's right. It's kind of frustrating. Well, there are studies that have been done, for example, in breast cancer. Breast cancer has a very large lobby group and are able to find sources of money and funding that other cancers can't seem to tap into. So there have been some studies in breast cancer, for example, with things like exercise and diet, which do show, that maintaining your physical fitness can be beneficial to your long-term outcome.
Right. I just wondered if there was any sort of, I understand there are a couple of integrated cancer care centers in the U.S. I was wondering if there was anything in Canada. But I guess the answer is no.
I don't think of the model you're looking for, no.
Yeah. Okay, thank you.
Yeah, no problem, Jane.
Okay, thank you. I want to thank the audience members for your thoughtful questions. I would also like to express my sincere thanks to Dr. Anna Tinker for this presentation regarding this important topic, and Alianka Skop for her translation. If you would like to listen in again to this, or you want to share this session with friends or colleagues, it will be available on YouTube next week. The next teleconference, which will be translated and posted on YouTube, will be on February 9th, 2010. The topic is Returning to Work with Maggie DeStasi. The next Caring Voices chat will be on December 9th on peripheral neuropathy with Dr. Laurie Ellett, and a question period in French only will take place on December 1st on the same topic with Dr. Anine Boulanger. Please note that the Caring Voices online chats and the question periods are not translated nor taped. Also, I would like to remind you to complete and send back your evaluation as soon as possible. Your feedback is important to us. Thank you for being part of today's session, and we hope you will participate in our next session.